Mr. Speaker, we are indeed all on the same side in fighting this virus, and I hope the Secretary of State understands that when we raise issues, we do so because we urge the government to improve its response to fighting this virus, because this remains a lethal virus, and for many it leaves them with serious, debilitating sickness. So everything must be done to drive down and eliminate infections and suppress the virus completely. With that in mind, I hope the Secretary of State can answer a few questions today, and I'm grateful for his advance sight of his statement. First of all, in order to avoid a second national lockdown, which we all want to avoid, an effective test and tracing regime is absolutely vital. I listened carefully to the figures that he outlined, but he didn't tell the House that of the numbers actually going into the system, they have actually fallen in the last week, down from 79% down to 72%. This system is not yet world-beating. Throughout questions, he's rejected criticisms of the private sector contractors who are involved in delivering this system, so there's no point in me raising that again. But the fundamental point is, wouldn't it not be better if money was spent investing in local public health teams, particularly in those areas where there are restrictions in place, so they can do more door-to-door testing, as we've seen, for example, in Leicester? Surely that would be a better use of public funding, for example, than paying for so-called influencers on Instagram to big up test and trace. Now, on testing itself, he now supports mass testing as a policy aim. It's something I've been calling for some months. It's something the former Health Secretary, the Chair of the Health Select Committee, has been calling for. Indeed, we tried to persuade him of its merits before the summer when we asked him to introduce regular testing of NHS frontline staff. He whipped his MPs to vote against it. But will he now, given that he's in favour of mass testing, introduce regular weekly testing of all frontline NHS workers? But to move to mass testing means evolving our testing regime from one which provides antibody tests and the diagnostic PCR tests to effectively a system of mass screening using more rapid on-the-spot antigen tests. He referred to rapid tests in his statement. Can he tell us when rapid on-the-spot antigen tests will be rolled out across society and which sectors of the workforce will be first in the queue to access those rapid on-the-spot antigen tests? Will he now also look at introducing saliva testing? It's being used in Hong Kong, for example. It will ensure the quick turnaround of tests. And I wonder if he's seen the study from Yale that suggests saliva testing could be as sensitive as the nose and throat swabs. What is his attitude towards pool testing? Because pool testing would surely increase the capacity in areas of low prevalence. Does he have a plan to introduce pooled testing?
He's right that we are investing in public health teams, and so we should. And as we discussed in questions, it's important to have the combination of the national system and the local. It's also very important that we communicate to people that it's important to engage in testing and the contact tracing for those who test positive and their contacts. And so being able to communicate to people so that they get those messages is very important, and we'll do that in whatever way is effective to get those messages across. He asked about the importance of mass testing. I bow to no one in my enthusiasm for mass testing. I'm very glad that he supports my drive for mass testing. He might remember the exchanges that we had some time ago when I rather stuck my neck out in pushing for mass testing when we needed to get to hundreds of thousands of tests. Well, we need to increase the number of tests again. He mentioned both saliva tests and pool tests. We're trialling both of those. But as with vaccines, which I'll come on to briefly, Mr. Speaker, we will only use testing that is validated and that is where the results are safe. So it's important that we use the world-class facilities that we have at Porton Down to make sure that tests are validated before we use them in public. But saliva testing and pool testing are both options that we are working on. When it comes to local lockdowns, Mr. Speaker, local lockdowns are working. This local action, again jointly between national and local government, is having an effect, and he knows this well from Leicester, where the case rate is right down. We absolutely do publish the data on which these decisions are made, and in fact, from last Thursday, now published data at lower super output area, which is the lowest level in terms of how local the test results can be reasonably published. And we have extensive data provided to directors of public health.